Hello, I'm Dr. Dennis McKenna, and I'm so privileged today to be joined by Dr. Brian Valerian. Brian, it's great to have you here.
Thanks for having me.
I think many people know Dr. Valerian as a surgeon here in the hospital. We're going to talk a lot about what you do, both in the operating room, but also some of the other roles you play here. We've known each other now since 1997, and it's certainly my great pleasure to have you here with me today. It's Monday, June 9th, giving you the update from Albany Med. Now, Brian, last week, we actually had the annual meeting of the Albany Med Health System Board, and three really important things happened at that meeting, and I want to just take a moment to talk about them. The first thing is, for the first time in 12 years, we've elected a new board chair. Mr. Bob Cushing has served as our board chair now for the last dozen years. Bob has been a remarkable leader for the health system, and we went over all the list of his incredible accomplishments, and we thanked him for his service. He will be thankfully staying on the board. Also, unanimously, the board elected the next board chair, Mr. Dan Pickett, who will assume that role on July 1st of this year. And we certainly welcome Dan and thank him for his willingness to serve in that very important role. The other thing that happened last week, which was amazing, is every year at the annual board meeting, we have what's called the Pillars Award. And the Pillars Award is a recognition of the individual who we look across the entire system that we want to celebrate. It's the highest level of award that we give in the health system. In the past, we've given it to board members, significant members of our community, members of our staff frontline who've done remarkable jobs. And last week, we were so privileged to give that award to Dr. Lewis Britton III, incredible cardiothoracic surgeon. Brian, I know you've worked with him, and I know that you want to say some things about him.
Yeah, it's an incredible honor for Dr. Britton to receive that, and I'm grateful to have interacted with Dr. Britton for such a long period of time. He always kind of looked after me, made sure I was going in the right direction, was a sounding board for me if I ever had any issues. He's, when you think about a surgeon, he's the true consummate surgeon and gentleman, and really heartfelt congratulations to Dr. Britton on this much-deserved award.
No question about it. I think among the things that we highlighted were the fact that he has trained over 1,200 surgeons in his career. He is somebody who helped start our ECMO program here at Albany Med. He is somebody who, quite frankly, was I think was the first to do pediatric heart surgery here at Albany Med. I said, I imagine what it would be like to be laying on a stretcher, scared, nervous about open heart surgery, and have Dr. Lou Britton look down over you and say, my name is Dr. Britton and I'm going to take good care of you. And I think that would be a very reassuring thing for all those people. So we certainly congratulate Dr. Britton. He was surrounded by friends and family and colleagues, and it was a wonderful event. And then we also rolled out our annual report, which is a very comprehensive look at all the things we do as a health system, whether it be clinical care or education, research, serving our communities. It was a system view. It was put together by our remarkable system Department of Marketing and Communications. I want to thank them for their incredible effort. And if you haven't had an opportunity to see it, I encourage you to grab a copy. It really is an outstanding look back of all the amazing things that have happened in the last year, and really a look forward of all the things we're going to do as well. All right, now Brian, Perkspot. This is a new web platform, like an employee discount program. What is it?
Yeah, it's a discount program for employees. It's free to use. There's many discounts across, I think, 26 categories, right. Electronics, apparel, travel, you name it, and you can find a discount in the program.
And so it was on the internet, and we encourage you to bookmark the website, or if you have to type it in from home, it's albanymed.perkspot.com. That's Perkspot. And this is great. We often talk about how we're always looking as both a recruitment and a retention strategy to say what are some added advantages or benefits or things we can do for our hardworking workforce, and this is one. So we hope you take advantage of it. Lots of discounts. We were talking to someone earlier who I think was calling out some of the ones that they were looking to take advantage of. So Perkspot. All right, let's shift gears, no pun intended. Let's go down into the Masry Family Emergency Care Center, where if you happen to be walking through, don't be surprised if you see a little car driving around, but that's okay because that's what we want. This is a vehicle, small vehicle, donated by the Capital Region and North Country Honda. The Leah family, you know that name, very generous in the community. They do a lot of wonderful things. And so this vehicle is an opportunity for a young patient who is in our emergency department who might need to get to radiology, right? Or for a test, if they're safe and could do so, they could drive themselves there. So we were looking at a picture of it, right?
Very sharp. It's very cool looking.
Yeah, for sure. And we want to thank the Leah family and Honda for doing that. And obviously, I know that our staff down there thinks it's a nice thing to have and something that will make that experience for the patients down in the emergency department a better one. Now, Brian, I want to shift the focus onto you, which is something I've been looking forward to in this video. I mentioned earlier, we've known each other now for quite some time. We came into the organization at the same time. I was an intern in emergency medicine, and you were beginning your training in general surgery. I think many people know that you went on to be fellowship trained in colorectal surgery, but you do so much more than that, and I want to focus on that. On the colorectal surgery, this is obviously a surgeon who operates on cancer of the intestines, obviously inflammatory bowel, many other medical conditions. It's a combination of obviously intense surgical procedures, but also medical management of patients. What attracted you to that specialty?
Really the variability. Every day for me is something different. Do small office-based procedures all the way up to complex reoperative surgery in the operating room. I can do colonoscopies. And I get to longitudinally follow some patients as well with certain diseases. So I have the full spectrum in my specialty.
And I'm certainly happy to say out loud that on many occasions I've called you, Brian, for family member treatment, and you've been quick to respond, and you've provided outstanding care. And I don't think there can be a higher compliment for someone than to say, I want you to take care of my family. And that's certainly how I feel about you. You would also, I know, be quick to give praise to your colleagues. Would you like to name some of the others, all of the others who are in your division?
Sure. We have a really great division that we look after each other and support each other. Dr. Edward Lee, Dr. Jonathan Kenyette, and Dr. David Chismark.
Yeah, it's a remarkable group, really. I mean,
Yeah.
Obviously, undoubtedly, the very best, probably within 25 counties or beyond. But if that wasn't enough, you also serve in a couple other really important roles. Let's begin with this one. You are the fellowship director for our colorectal fellowship, and that is about training the next generation of surgeons who do the incredible work that you do. Talk about that.
Sure. We're one of the about 60 programs across the country that have 100 training spots or so to train general surgeons into specialty training to be colorectal surgeons. We started that program about 9 or 10 years ago, and we've been able to train one colorectal surgeon each year to go out and serve the community as a colorectal surgeon.
And that's remarkable because that means that not only do some of them hopefully stay locally and take care of people maybe in other hospitals, but they may go other places in the country. But that's an incredibly important part of what we do here. Now, in addition to that, not only do you provide great care for your patients, but you have a real particular focus and interest on quality. You are the vice chair in the Department of Surgery for quality. And that's not just focusing on quality for colorectal surgery, but all of surgical care at Albany Med.
Correct.
Talk about it.
Sure. I've always had an interest in surgical quality and quality outcomes, patient outcomes, and many years ago was able to get involved in a program called NSQIP, which is the National Surgical Quality Improvement Program, which is the largest surgical database in the world, which is supported by the Quality Management Department here with again, collecting data on surgical patients across the spectrum, all surgical specialties. Our data and patients are input into this database. It gets risk adjusted for patient comorbidities and other illnesses. And then we're able to compare our outcomes both at the hospital level, the individual level, with patients really around the world.
And you work closely with the quality department here at Albany Med. You focus on areas including urology and vascular surgery and others. You all publish papers on this, and ultimately what it's really about is studying the data and figuring out how we can get better.
Correct.
Which is amazing. If you've paid attention in the past, you know that at Albany Med we're an academic medical center, so we do clinical care, we do education, we do research. I just named all three areas, which makes you, Brian, the classic academic physician. Another component that could be added to that is service. And you, in fact, are serving in a very important role. You're the president of our medical staff. The medical staff at Albany Med, over 1,000 physicians and other professionals who serve on our medical staff. And that's an elected position by your peers. and you've been in that role for 2 years.
Correct.
And so congratulations and
Thanks.
thank you for your service there. That's a lot of time. And I know that there's a lot of meetings that go on with that. I know how much you love meetings, Brian. But you've taken the opportunity to use your platform to focus on two really important areas. What did you focus on last year?
So last year's focus was on wellness, physician wellness, and burnout. As you know, across healthcare workers and providers, burnout is a significant issue. So really wanted to highlight the work being done here at Albany Med, as well as the initiatives that are underway to really improve the environment and support physicians and healthcare providers and their wellness.
Which is great. I've certainly heard you present on that at the annual meeting of the medical staff. You've come into the boardroom and you've talked about that. It's obvious you're very passionate about that, and I applaud that. In addition to that, this year, while that work on wellness continues, you've also now focused the spotlight on another area.
Yes, patient experience, which is, I don't want to say up and coming, it's been around for a long time, but there's much more focus on it now as we think about our patients, their experiences here, the satisfaction they get from the care. And interesting things about patient experience: increased patient experience or improved patient experience drives better healthcare outcomes. It decreases healthcare costs. And interestingly, it really improves morale and retention of staff across the board, all healthcare providers, nurses, physicians, and other support staff. So really important initiatives going on here across the institution to improve patient experience as well.
Well, given your significant positive reputation here at Albany Med, I'm sure that you're saying to people, hey, it's important that we focus on wellness. It's important that we focus on patient experience is very powerful. And I'm sure that Mary Alice Cullen, as our Chief Experience Officer, is appreciative of your lending your voice to that, as I'm sure Dr. Gina Geis is in the wellness space. So thank you for that, Brian. And although, like I said, we've known each other now for probably a little bit more than 25 years. I don't know if we'll work together another 25, but I hope it's many more, because we're really fortunate to have you here.
Thank you.
And you're not only a fantastic surgeon, but obviously a leader in many other areas. So thank you very much.
Thanks.
All right, we're going to ask you, obviously, to continue to help us in everything that we're doing, and we really appreciate you now more than ever, showing up, being here, taking care of our mission, and we'll be back and give you an update in 2 weeks. We ask that you once again, please take care of yourself, take care of each other, and we'll see you soon.